Colleagues ask me, how did you find out that phenytoin has such a remarkable property in reducing pain for peripheral neuropathic pain syndromes? And I have to give the honor to an American multi-millionaire, tycoon of Wall Street. It is Dreyfus. And Dreyfus was a very remarkable man who wrote a remarkable book, The Story of a Remarkable Medicine. This entire book is focused on phenytoin. Why phenytoin? In 1963, a great piece of luck led me to ask my physician for a medicine that was not supposed to be useful for the symptom. Dreyfus discovered that phenytoin can do much more than only help in epileptic patients. He found out that it has a broad mechanism of action and it can be used in a great variety of disorders. Because he was so committed, he not only wrote this book, but he also created a foundation, the Dreyfus Medical Foundation. In that book we find an entire chapter which is focused on the usefulness of phenytoin in the treatment of pain. Phenytoin usefulness in pain is enhanced by the fact that it's not sedative and it's not habit forming. It can be used alone or in combination with narcotics and other pain medication. Quite important aspects of pain medicine are summarized here as properties of phenytoin. Then in the book we find also a chapter on the use of phenytoin as a preventive. Phenytoin has been found useful for over 50 symptoms and disorders, and this suggests a broad potential for preventive medicine. After we found out about these suggestions, we dived into literature and we found actually that there is a whole bunch of articles which support the specific cytoprotective and neuroprotective properties of phenytoin, which lays the foundation of its use as a preventive medicine or as a protective medicine. We wrote 4 articles on the neuroprotection of phenytoin, and the last 2 articles were with specialists in ophthalmology, because they can directly look into the retina and find out the effects and the protective effects of phenytoin on the retina. And we know that the retinal cells are quite tiny, very sensitive cells, just as the small nerve fibers in the skin. So by applying phenytoin on the skin, we reach the small nerve fibers in the skin, and we hypothesized at that time that phenytoin might be as protective for the nerve fibers in the skin as it is for the retina cells. And this was the reason why I bought in 2015 a jar of 100 gram phenytoin, and we prepared our first cream based on 10% of phenytoin in a special base, and we treated our patients with peripheral neuropathic pain. And indeed we found out that many patients responded favorably. Within 30 minutes the pain was reduced after applying a cream with 10% of phenytoin. This was the beginning of our exploration of the role of phenytoin in not only treating pain, but perhaps also protecting the nerve cells. Phenytoin cream now has been compounded by our pharmacists in a different range of concentrations from 5% up to 20%, and in certain patients we find out that if they do not respond fully on 5 or 10%, going higher into the realm of 20% increases the likelihood that these patients will at the end, at the highest range, also respond to the treatment with phenytoin cream for their painful peripheral neuropathic pain syndromes.